Anyway, so nowadays we don't have repeat exam and proper exam. Whatever the exams we have, aiming 2 exam per year, whoever the people finish their professorial appointment, they can sit. So previously only we said repeat exam and proper exam. Okay, this is a March 2019 exam question paper SCQ. So now you should have some idea about the way of asking question, because I have discussed this thing last time also. I suppose so you are ready with kind of answers. So this will be effective only when you are coming with the answers and you are ready, and then you can judge yourself. So whether you can successfully write the questions. This is how you should improve yourself. Otherwise, no point just listening to the answers and you make up your mind with it is possible for me. But when you go into the exam, so you will really face the problem: timing, planning, gathering informations, and coming to correct track. These are the problems in the exam. So I have gone to during 1 week I finished the marking the question papers in your seniors, so then I can understand how people going in wrong track, right? Because without, so this is for your benefit, I am telling. Some student, so without reading the question properly, they answered the elective induction of labor as elective cesarean section. So then halfway through, after writing 2 pages, then almost suddenly they understood this is not the elective section. Then they cut the answer and then start writing for the induction, but they could have written the answer only half a page because time is gone. So you can understand how badly they score for that kind of questions without going properly and understand the question. Hello, can you hear me? Is there any disturbances? Yeah. So then, so other things. So yeah. So when you ready with the answers and come, so then you understand what are your particular problems. So understanding, timing, planning, gathering information. Then of course, when you practice it, automatically 2-3 papers, when you written down 2-3 papers, you understand your deficiencies, strengthens, and then you can improve yourself. That is why always I am encouraging you to practice this thing, and then it is easy for you to uh, in a proper place when you come to an exam to answer the questions, right? So okay, shall we go to the first question? Yeah, first question asks about discuss the strategies to reduce the perinatal morbidity and mortality associated with preterm labor in Sri Lanka. Excuse me. Madam, mama may Zoom lecture in my call. Madam, mama may Zoom lecture in my taking call again, madam. Yeah. So here, so first of all, you have to understand the words discuss, strategies. So these words are familiar to you now. Discuss, strategies. Last time also we asked about strategies. Mean what are the methods? What are the things you are putting in place to reduce? Last time we asked to optimize. So reduce, improve, optimize. So more or less same words, like the same meanings. So last time also you saw that perinatal. So before birth, that's mean once the baby is viable inside the uterine cavity, in utero, and the perinatal, then 7 days after birth, that is a perinatal period. Morbidity and mortality. Morbidity means whatever the illnesses. Mortality means death associated with preterm labor in birth in Sri Lanka. So it is very easy when you understand the wording here. Discuss straight what are the methods you put in place to optimize or reduce or improve baby's outcome due to preterm labor. So that is the, in simple way, that is what the question is asked. So then you have to plan. So you think in the broad sense. Don't go through the question answer now. So you make your mind, follow me, right? So what are the now you are in the planning stage. You understood the question. So you are now in the correct track. So you then plan. So write down now in few minutes. So what are the methods that you want to apply to the setting to reduce whatever the illnesses or death of the preterm babies in Sri Lanka? So you have to understand, we are asking a Sri Lankan setting. What you see commonly in your practice, the professional appointment, whatever the clinical appointment. So then in the planning stage, so then you have to understand, don't write A to Z, what are the morbidity, mortality, morbidity, breastfeed distress, then different the growth problems, then the neurological problems. So those are the complications. So I have seen in last question, induction of labor. So they have written all the complications can happen. We never ask that in the question. So if we ask what are the perinatal morbidity in the preterm labor, then you have to ask. Here we don't expect that kind of elaborated things. So then you plan the answer, right? So first of all, so you have to think about, starting from the beginning, what are the things that you can introduce. So you know that is, then you have to get your basic understanding, basic core knowledge about preterm labor. So whatever the way that you gain this knowledge or lectures or reading a textbook or gaining from the board classes, whatever what we have discussed with you, you know that. So you have to give a introduction now. Introduction part is a global sense. You have to write down. So what is the preterm birth? How the bad it is affecting to the country, right? And what is the magnitude of the problems? You know that preterm labor globally, not only to the Sri Lanka, it's a preterm birth is a burden to the health system. Also increasing trend like induction of labor, because you know that different environmental, different personal and different these things. So preterm birth are increasing in trend worldwide, not in Sri Lanka. Increasing trend. It is a global issue, right? So then, so if you know the incident, so you can just tell. So usually, so these things you should, the good student should know, right? Usually the incident is around 10 to 20%. That's mean 1 in 10 in 1, 10 in the like if you have 10 births, 1 to 2 births are preterm. That's mean 10 to 20% of births are preterm. So that is significant amount. So that is the introduction you have to keep in the place. So then you have to discuss in the body. So what are the proper measures you are going to do at the end? So you're going to write down the conclusion. So conclusion, of course, then you have to tell that adopting these measures, so you can bring down the preterm labor very very effectively low down, and if there is a preterm birth, you can improve their morbidity and mortality by doing certain measures. So this is the positively affect the country's health and the economy. So that is the conclusion, something like that. So there should not be an exact wording, but introduction you have to give the what is the magnitude of the problem. So this is a basic understanding you have to get when you answer another question as well. I explained this thing in the first last time also. Introduction, the main body, and the conclusion. Introduction you give the magnitude of the problem. So then body, the measures proper, what you are going to take and put into the place, and then at the end the conclusion. So if you are doing these things, so what is the end result? End result will improve the baby's health. So that is important for the country health wise as well as the economically. It is important to the country, so we can save the millions of money. So that is a conclusion, right? So then that is a basic planning of the question. So then you come to the body of the question. Then you write down in planning, still we are in the planning stage. So you write down what are the measures you are going to take, right? As I said, don't concentrate on this answer, but without concentrating on this answer, now you have to have a mind mapping. So whatever the things come into your mind, you jot down in your paper. So these are the things I'm going to write down. You know, now, so we are coming to what are the reasons to, so we'll first discuss about the how to bring down preterm labor. That is the main measures we have to take. Then how to bring down, how to reduce. So then once the baby is born, what are the things that you are doing to improve their health? So the two categories now, how to bring down the preterm labor. So what are the measures taken for that aspect? And then once the baby is born, because you can't bring down to zero, no, there will be some amount of preterm labor. So then, so what are the things that you are putting into place to improve their health if there is a preterm birth? So then, starting from the beginning, what are the measures you are going to put into the place to bring down the preterm labor? That will start from preconceptional stage. So then antenatal period, then delivery, and postpartum. So that is the, you have to take some measures to bring down the preterm labor, starting from the preconceptional time to throughout the pregnancy and postpartum. And then you have to take measures to improve their health once they born preterm. Then those are another two categories, right? Preconceptional counseling. Then you just jot down, all right, preconceptionally. So preconceptionally, so you have to recognize women who are at risk of preterm labor and take measures to reduce the preterm delivery on these women. So preconceptionally, there are risk factors you have to identify, particularly low socioeconomic status, and then previous history of preterm labor. So preterm history of any cervical intervention to the cervix, like a bone biopsy and dilatation. These things will weaken the cervix. And then, you know, these drug addicts, smoking, alcohol, recreational things will increase the preterm labor. So preconceptionally, then you have to improve their health, avoid the risk factors to reduce these things. Particularly, then you have to mention preconceptional care is very important to reduce preterm labor. So risk factors can be identified as these things. So then, so you take measures to improve their health. So anemia, the major issue, can cause preterm labor. So to measures to reduce alleviate or improve their the risk factors to reduce the preterm labor. That is a preconceptional care that you have to give. for this purpose. Then antenatal care. So antenatal period, so what you have to do? So early booking. So Sri Lanka is known to have a very good health setting, especially maternal health. So more than 80% of mothers, according to the latest statistics, more than 80% of mothers will register or first registration called booking happen before 12 weeks. So that is a very good trend. Then you can catch the 80% of mothers the first trimester. So then the booking, the purpose of booking visit is to identify the risk factors, and then you have to have a plan in subsequent when the gestation is advanced. So there also you have to identify risk factors. So then you have to screen for preterm labor the risk factors, and then identify then if some people the patients are in high risk group for the preterm labor, you have to refer to tertiary care center for the appropriate management, early referral. So that you have to mention tertiary care center, whatever the place where the consultant is available for the measures to take or to manage. For example, the previous history of preterm labor. So then you have to start micronized progesterone until 34 weeks. That will significantly reduce the preterm labor rate. So then, in addition to that, you have to put a cervical cerclage at 13 weeks after dating scan. So then you mention those particular two things will reduce preterm labor in a significant amount if there is a history of preterm labor with the cervical incompetence. For that purpose, it is mandatory them to have cervical length measurements in the first trimester. It has to be transvaginal ultrasound scan to measure the cervical length. So nowadays, of course, there are no evidence. The people recommend the dating is compulsory and the measure cervical length. So because 10% of the birth are preterm, so if you accidentally found the short cervix less than 2.5 of funnel length, so then you can take the measures in situ and you can reduce. Cervical length measurement the first trimester with the transvaginal scan is with the dating is very good measure that you can take to reduce the preterm labor and identify the risk patient. So then you know that infection, genital tract infection can cause preterm labor. So then if there is a previous history of preterm labor, so it is recommended you to do high vaginal swabs and identify is there any pathogens causing this thing, and you start treatment in second trimester. So that is also one of the measure you can take first trimester. Right. So that is the trimester wise. What first trimester is very, very important. You to take measures, screening, identify the patients, and take measures to reduce this thing. Then, so you know that preterm labor we haven't asked here about the preterm labor, the spontaneous. So there are so many preterm labor happening iatrogenically. Iatrogenic preterm labor means, so what the intervention, so we do the intervention, we take the baby out early. You know that examples, if somebody developing the progressive development of medical disorders like a preeclampsia. So then you have to take the baby out early. Liver disease, you have to take the baby early. Sometimes heart disease, because it is not compatible with maternal life. So there are some medical issues. So you have to take the baby early, and then so that is also preterm labor. You have seen that we are taking the babies at 28 weeks due to preeclampsia, fits, or liver disease. So you have to optimize if you want to advance the gestation to avoid preterm labor, you have to optimize their health, their medical issues. So then you have to identify them and you have to give them shared care, liaise with other disciplines, So improve their health. It's diabetes, hypertension, renal disease, anemia, uh, connective tissue disorders like SLE, antiphospholipid syndrome. So very good multidisciplinary involvement, improve their health and advance their gestation, and then you can reduce the morbidity and mortality due to preterm labor. So then, so you are coming to the next point. So it is worldwide recognized, recommended magnesium sulfate has brain protection effect. So if you want to deliver baby due to any reason before 30 weeks, so you have to, it is recommended to give magnesium sulfate. So that will, you know that the brain, the CNS morbidity is more. They can develop, the worst scenario, they can develop CP, development delay, neurodevelopmental delay, fits, hemorrhage, intracranial hemorrhage. So magnesium sulfate will have a protective effect on the CNS. So consider means recommended mag sulfate for the babies who are need delivery before 30 weeks. Then the next general point is a steroids, maternal steroid. You know that maternal steroid is important to improve respiratory distress of the newborn babies, especially if they are delivering before 34 weeks. So if you want to deliver the baby before 34 weeks, due to any reason, if you have time, give maternal steroids. So steroids will improve lung maturity. It will reduce intracranial hemorrhage. Those are the main two morbidities you can observe in preterm babies. So steroid has two advantages. One is improve the lung maturity. So it will reduce intracranial hemorrhages of the newborn babies. So maxalpate and steroids. So you have to mention in the antenatal period to reduce the preterm the morbidity associated with the preterm labor. So initial part we talk about the how to reduce the preterm labor. Then we are talking about the measures to take when the baby is born preterm to improve their health. So then other measures that you have to take, there are sometimes the neonatology facilities. You know that developed countries, if a baby born at 28 weeks, the survival rate is more than 90%. But in our country, in our setting, it is around 80 to 85% because improved neonatal facilities. So improved neonatal facilities providing infrastructures, neonatologist, dedicated units in ICU, preterm PBU, neonatologist, the centered, he or he is the team leader, the environment, other infrastructures are important, ventilators, important to improve their health. Then the intrapartum care for the preterm babies. So intrapartum care, the preterm babies means the after delivery there should be a neonatologist on site. So there are resuscitators, and then they have to take the measures to reduce the hypothermia. And then if the babies need the intubation and these things, there should be a skillful people. So likewise, there are measures you to take at the time of delivery. And preterm intrapartum care means the monitoring and just after care is very important to make them survive due to preterm labor. Especially if babies need to have cesarean section to deliver them, it has to be done by the experienced person. There are some examples that you have to do by the experienced person. For example, especially preterm babies because the lower segment is not formed well. So if you are going to struggle to deliver the baby, so then you can damage the baby, brain, contusion, internal organ damage, and fractures. So experienced obstetrician is needed. So somebody is going to have delivery by cesarean section preterm. Then then we discuss preconceptional, antenatal, starting from the booking, the subsequent management. Now we discuss about the intrapartum and labor, and then we are discussing postpartum measures. Postpartum measures. So you know that you need to maintain the healthy gap, birth to birth gap. It has to be usually 2 to 5 years. So if a woman get pregnant before that or after 5 years, so then they are tend to get preterm labor. So then you have to address postpartum contraception very well. You have to counsel them, and they should make a decision before discharge. So then they have to practice one of the method after 6 weeks. So that is called if somebody not use reduce the unmet need of postpartum contraception. So then you have to address that issue, that will reduce the significant amount of preterm labor and maternal death as well. So postpartum contraception, you have to discuss in details what is the importance of it. So we are going to counsel them, counsel not the in details, but these points you have to mention in the answer about the postpartum contraception as a category. Then at the time of discharge, so then you have to give a very good diagnosis card by the house officer and supervised by the middle grade or senior doctor. If somebody delivered preterm, you have to mention why preterm delivery happened, if it is iatrogenic or spontaneous. Is there any suspected reason for that? So what are the measures you are going to take next time to reduce the preterm labor? So you have to write down these things in the diagnosis card. You have to tell the mother, family, so things are here. So then next time when you are going to the obstetrician or the hospital or clinic, you have to show this diagnosis card for the appropriate measures to be taken next time. So those are the postpartum care that you have to give, contraception and very good diagnosis card mentioned in the details. Then what are the general measures? General measures. So any situation if you want to improve the current practice, maybe induction of labor, preterm labor, cesarean. So audit is very important. So audit carries some marks if you mention in this kind of situation in regular audit and identify the defects. So then you discuss in the management and ultimately keep the things ready or address the deficiencies, not these things happen further. So concurrent audit is very important to reduce the preterm labor and improve their morbidity and mortality. And then guideline is another thing. Those are the three. There are three things that you have to mention as a general. So this is how you should get to know what are the things you have to write. So every situation, if we ask this kind of question, it will carry, if you write audit, guidelines and protocols, risk management. Very easy, you to score marks. This time also for the induction of labor, if somebody written these things, will have some amount of marks definitely. So here also at the end, you have to write down the carry out the intermittent or the regular audit is important to identify the defects and then put in the things in place, not to the improving the setting. Then the protocols, follow protocols and updated guidelines important to manage the patient coming with the preterm labor and to reduce the problems happening. And then if there is a preterm labor or some bad outcome, risk management meeting and then identify the things. So that is called reflective practice. So then you can identify the individual case, you can identify the problems, and then you can teach staff, you can train the staff, you can improve the outcomes. So those are the last three things that you have to mention in the question. So then at last, the conclusion. So I think it is clear to you. So this is second time I am discussing this kind of question. So I said in brief, I said write the introduction, the body of the question, and the conclusion. Introduction, magnitude of the problem, how it badly affect the country or globe. So what is the magnitude? If you know the incident, you can write down. So body, then you write down what are the things, proper things that you are going to do, particular things in categorically wise. So here, so I divide this thing, that is according to the question, preconceptional, then antenatal period, then postpartum, and other general things. Then at the end, the conclusion. So if you put in these things in place, so what is the observation you can make? How can you improve their quality of the outcomes? Then it is very good for the country economy as well. So that is the answer for this question. Is there any questions, queries up to now? You can ask. You can all send message in the chat page. Is that clear to you? Anything you want to clarify here? Somebody can answer. Then and there you have to ask the questions. If there's any clarification, so I will answer for that as well. Hello. So any questions you want to ask? Yeah, so few questions asked. Right, few questions asked. So asking about the, can we write down this question as a primary and secondary prevention? Of course, so the what we need to have the points what we mentioned here. So when we are going by the some kind of the categorical wise, so if you are writing primary prevention, of course, so you have to write down primary prevention. These are the things that you are going to do. Secondary prevention, these are the things. Of course, primary prevention here to avoid preterm labor, reduce preterm labor. Secondary prevention, once the preterm labor is happened, what are the things you do to reduce their problems? Then the complication management is tertiary prevention. So likewise, it's not a problem. So you can write down in any way that the plan is, you can plan the question, the answers anyway, but this point has to be there. Then next question is asked about tocolytics. Very good. So tocolytics also has a place. So this is the, even though this is a model answer, if you have written the tocolytics here, so that you will get some marks for that. Then, so asking about the, do we need to write in a paragraph or point form? Of course, this is a long essay. So if you write as a essay type, you will carry more marks, global marks, rather than writing in point form. So then ask about the things to do for the newborn during postnatal period. Of course, so then, so that is out of our scope. As an obstetrician, so we manage up to the delivery. Thereafter, the newborn babies, the care for the newborn babies taken up by the neonatologist. So that is the, in neonatology or pediatrics. So that is the part that you have to written down. But here, up to delivery is the one we expect from your answer. From your answer. So the neonatal management is beyond our scope. So then other question is, do we need to write about early referral of neonate to neonate cardiologist X-ray prevent neonatal death? Of course, I said when you manage antenatally, so you have to do different referrals, anomaly scan and these things, and whatever according to the mother's the medical issues, then you have to liaise. But after delivery, right into cardiologist and these things, that is for the neonatal part. So you don't need to write after delivery what you are going to do. So then ask about, do we need to write down the postnatal ward management, measuring fever, daily weight, establishing feeding? So of course, so in postnatal period, so whatever the feeding and these things, still the neonatal establishing breast feeding is, you can just highlight, but other parts, so how to make the things to improve the body weight, then improve the neonatal the anemia and icterus light phototherapy. This is neonatology part. You should not write these things. So do we need to write the drugs used as steroid or tocoid? No. So I said, so if somebody asks about the the question about the preterm labor management, so how we are going to if somebody come in with the preterm labor, so what are the you discuss the management of this patient. Then of course you have to write the steroids and these things. What are the names? What are name of tocolytic? This is a general question. So you just write. So you are going to give steroids, tocolytics. That's all. We don't expect name of the drugs, doses of drug. This you have to understand. This is a general question. So you have to write down these names. If we ask about the particularly preterm labor management in the the structured essay question, basic principle of management of preterm labor. If somebody come in at 32 weeks with preterm labor, that is the answer you have to give. But here, you general statement, you write tocolytic, steroid. No need of writing down the different drugs you are using in this situation. This is a general question. So same thing happen. I know that if you somebody not understand the question properly, this kind of things can happen. For example, the last question paper, induction of labor. So some students, so they have written method of induction of labor, nothing about to improve the outcomes. They have written they are the pharmacological method, mechanical method, the membrane sweep, more details on that. But we expect something about the induction of labor in general. Pharmacological, there are 2-3 things we can do: pharmacological, mechanical, and sweeping membrane. Membrane sweep is recommended for. That is according to, we use the methods according to cervical favorability. So that's all that we expect from that answer. Not different method you are giving like a prostaglandin, misoprostol, Lemoniria stent, Foley catheters. You don't get any marks writing down that kind of question. So you have to write that kind of question. If we ask, so what are the method of induction of labor available in Sri Lankan setting? That is the answer you have to give for that question. But we have asked about the general question about induction of labor. Now you should understand, when you are writing down this kind of general question, what are the things that you have to write down, or when you are focusing for the particular point, induction of labor per se, how we are going to manage, or preterm labor per se, how we are going to manage, then you have to write down all the methods and things in that question. So get a clear understanding. Otherwise, you are unnecessarily taking time writing unnecessary things which don't carry marks. Understand? I think you will get a good understanding by discussing last time and this time about this kind of general question. Is that clear? Shall we shift to next question? We have only 20 minutes.
Okay, sir.
Okay. Here onwards, I'm going to discuss briefly. So what are the things? These are the typical structured essay question, right? Uh, so here, 26-year-old woman in her first pregnancy at 36 weeks of gestation, admitted to antenatal ward with the history of reduced fetal movements for 24 hours. She's in pregnancy 26 weeks, year old 36 weeks, reduced fetal movements. Her antenatal period is not uncomplicated. Her antenatal period was uncomplicated means she has no diabetes, she has no antepartum hemorrhage, she has no any other medical problem. Uncomplicated. Don't make things, don't assume the things there, because it is particularly said it is uncomplicated. You don't know now situation, but antenatal period was uncomplicated. So then you have to believe the examiner or who the person who made a question. Antenatal period is perfectly all right. Don't talk about the diabetes or hypertension or connective tissue disorders. So then, utter wasting time. Ultrasound scan confirm death in utero. So then, so she came with a reduced mole. Then somebody did the ultrasound. It confirmed. Confirm means it is confirmed 100% sure. Then the woman has been counseled about that woman or family counsel about the death in utero. She knows now. The first question is then that is how you should understand the question. Then first question asks about briefly discuss your clinical assessment of this women after detecting death in utero. So here we ask about the discuss your clinical assessment of this woman after detecting death in utero. So then I suppose when you come to the exam, so at least you have seen this kind of scenario, because so if you don't see this kind of scenario, so that's mean you haven't done your professional appointment correct the proper way, because once a week, like once a week or once or twice a week, you can see the death in utero. So then you know how we are managing this kind of patients. The first thing we see, then death in utero happen. So then, so we are not hoping for the baby. Now we are hoping for the mother. The first question the relatives ask is whether mother is all right, her life is at any danger. So then initial assessment you have to do or directed to see whether mother is in danger or not, because death in utero happen due to different maternal reasons or fetal reasons. But maternal reasons, the dangerous things can happen: maternal sepsis, abruption, severe preeclampsia. These are examples. Due to those things, death in utero can happen. So those are the things that it can endanger maternal life. So then you have to do the very good maternal assessment to see whether she is in a safe situation. See whether any features of sepsis, history, fever, any interventions, then tachycardia, hypotension, fever, temperature, and then consciousness. You assess for the sepsis. So assess for the placental abruption, whether there is any abdominal tender in a bleeding before coming, pain, per-vaginal bleeding, abdominal tenderness, woody hard abdomen, abruption. Any features of preeclampsia, impending eclampsia, blood pressure, symptoms of preeclampsia, impending eclampsia, headache, visual disturbance, and so on, and blood pressure, and then swelling of the legs, hands, facial swelling. So these things that you have to do as an initial assessment to see whether woman in the safe situation. So symptoms, signs. Then, so you have to see maternal well-being. In the other hand, the mental well-being, because she is in distress now. She's crying. She is depressed. She will say, I want to get suicide. She will say, I can't stay here. So see the physical well-being of this is the other well-being that you see whether mother is at any danger of due to physical diseases. Now mental health. So you have to look after. So you have to counsel the family, keep her with the family members. You explain her how she is coping with the situation. So then at the end, so you have to see whether by doing ultrasound scan or whatever the baby in which position, because if a baby in a different position, so sometimes you may need to decide the mode of delivery in different ways. But if a baby is a cephalic presentation, then you can achieve vaginal delivery. So initial discussion, the clinical assessment, you have to see mother is in good, whether mother is in danger, mother's clinical symptoms, signs about dangerous things, sepsis, placental abruption and PET, their mental well-being and baby's presentation is so. So that will carry 30 marks if you discuss this thing in that way. Is that clear?
Yes, sir.
Okay. So then second question, second part we asked 2.2, the list 5 investigation, list and 5, list and justify, right? So that is how you can see in our question papers. So we usually, so listing is not enough, you have to justify. So then only you will get the full marks, 5 investigation that you would carry out in this woman. You know that, so the according to the situation, then you have to do the situation. So I said placental abruption, preeclampsia, and sepsis. So you have to keep in mind. So full blood count is very important in this kind of situation, because to see whether there is any anemia. Thrombocytopenia is one of the complications known to preeclampsia as HELP syndrome. The death in utero per se, the leukocytosis and these things will reflect any sepsis, ongoing sepsis. So you have to explain full blood count, arrange full blood count due to these reasons. So that is the answer we expect. So then CRP is important to see whether there is an ongoing infection. Usually in case of sepsis, CRP level is several times higher than normal. So then HbA1c, usually this is a recommended investigation that you have to do when somebody present with the death in utero, full blood count, CRP, HbA1c, because HbA1c, you know that diabetes is one of the reasons that sudden death in utero can happen. So sometimes there may be undiagnosed diabetes. HbA1c will give an idea whether there is a hidden part of diabetes in the mother. So HbA1c is recommended at the presentation. Then bleeding risk. So you know that this kind of patient, they are having bleeding risk. So INR is important to see whether they are at risk of bleeding, or is there any bleeding derangement. Septic screen is important. So blood culture, urine culture, high vaginal swab is a compulsory 3 investigations you have to do. Any patient coming with a death in utero or fever, cultures, blood culture, urine culture, high vaginal swab for culture ABST for the as a septic screen. Then you can identify the exact cause for the pathogen, and then you can target for the antibiotics. The ultrasound scan is paramount important in this kind of situation. So you can see at the time of ultrasound scan gross fetal anomalies which lead into fetal death, the confirmed presentation and placenta. So is there any features of abruption is not reliable for the diagnosis of the abruption, but sometimes big hematoma, retroplacental cord you can diagnose with ultrasound scan. So then you are right, when you are writing the 5 investigation with justification, so you have to write these things to get the full marks. Clear?
Yes, sir.
So now the half of the marks you can get for the management of this woman. So you have to understand. So that last time also, so the majority went wrong track answering this question. First two parts they have answered satisfactorily, but this thing, so they didn't understand the question. What the question is that outline the management of a labor, not the delivery. When you, if you mention here delivery, you can write down vaginal delivery or cesarean. But here we ask about the labor. Labor means vaginal delivery. If you write down anything about the cesarean, you don't get a single mark for that. But people, student last time, majority of them answered this question. So she can deliver vaginally or cesarean. So if she has any endangering this thing, needling urgent delivery, cesarean section. So if she doesn't have any urgent things or baby present in Kepeling presentation, if she is happy to have vaginal delivery, so we'll go for vaginal delivery. So that's how they answered majority. But you have to understand here, so we haven't asked about her delivery, we asked about the labor. So that is the keyword that you have to highlight in this question. Otherwise, so you are going in a wrong track. So that is why the majority of people couldn't answer this, get the high marks, because the understanding of this question is in a wrong way. So if you go through our guidelines, unit guidelines, updated guidelines, so you can see this kind of the management of intrauterine fetal death. So if you go through these things, so if somebody is well aware about the guideline, he could have answered this question and taken highest mark out of 100, because everything, so when you formulate the marking scheme, taken from that, because that is what we practice, that is what you see in the clinical setting. So there it is particularly mentioned the labor management in the guideline, particularly said don't do ARN, it will introduce infection. Avoid per vaginal examination, frequent examination, because introduce infection. You can induce labor with augmentin if she is with the oxytocin if she is not in labor, the following ripening of the cervix. It particularly said unless she is having features of infection, no routine antibiotics needed for this patient's labor management. She is in distress, sensitive care with the labor companion is recommended for management of this patient in the labor room. So you should not keep her with unnecessary pain. You have to use whatever the available methods to relieve her pain. Otherwise, so she will suffer due to pain and her mental distress due to fetal death. So these are we mentioned these are in point form, but you have to take one by one and you give some account. So you have to keep blood ready, because they are at risk of developing PPH, and keep 2 pints of blood ready and cannula in situ. So you have to expect longer duration of labor and second stage, because the head is not well fitted to the cervix, and because of that, so you have to expect longer duration of the labor and second stage. Don't hurry to deliver the baby. Then at delivery, you have to check the cord placenta for any abnormalities, or you may send the placenta for histology or take a culture and ABSD for the placental bed. So general examination of the baby for the anomalies, you have to document it. To determine the sex, which is important because parents will ask what is the sex of the baby. Sometimes may be difficult because some degenerative changes. Check the baby's weight and document it. So at the same time, you may mention, so you arrange the the postmortem of the baby. Of course, that is a management in the postnatal side. But here we ask about the outline the management of labor. That's mean the labor room management. So it is clearly mentioned the labor room management, the guideline. So what we expect, the answer is that avoid ARM, avoid frequent vaginal examination. You can induce the labor with oxytocin, no routine antibiotics, sensitive care, labor companion, pain relief, blood ready, expect longer duration of the labor, and at the time of delivery, examine cord, placenta, baby, determine the sex, check the body weight of the baby, and document it. So that is what we expect in the labor management. So if you have written these things, so you can score full marks out of 100. Understand? There are a few questions asked. So first question asks about is there are clear morbidity moment I give it all no her antenatal period uncomplicated. Yeah. Uh, so first question asks her antenatal period. So we stated her antenatal period is uncomplicated. So can we check preeclamptic features? So I said antenatal period uncomplicated, not now. The current situation, can somebody develop within 1 hour high blood pressure, headache, visual disturbances, and presenting with the preeclampsia or infant eclampsia? Possible, no? Even though antenatal period uncomplicated, so unpredictably she can present with the preeclamptic features. So definitely you have to check whether she is preeclamptic in this side of situation. So second question, is there any indication for ARM? Example, abruption. There is no indication to do ARM in this kind of patient, even though the abruption, because in a live fetus, if you suspect abruption, of course, you have to do ARM to see whether the blood is likewise blood is stable. But in this situation, if there is a abruption, suspect abruption, ARM is not recommended. 2.3, if there is an immediate risk for mother, should we explain that point? So when we ask that the question there, so we ask about the outline the management of labor. So then at that point, of course, say at the beginning you assess mother whether there is an immediate risk. So then if there is an immediate risk, of course you have to do cesarean section deliver. So here we assume that the management of her labor means she is suitable for vaginal delivery. There is no indication to do anything addition to that, because life is at the moment is safe. Because at the first question we asked to assess the immediate risk. So third question, outline the management of her labor means she is fit for vaginal delivery and labor. So then don't assume that she is at immediate risk of something. So then we have to deviate from this question and the answer will be different. So that's why you have to understand the question. You have to assume we are managing her labor. She's allowed to have labor, vaginal delivery. So then we could have asked, so what is the how we are going to manage her delivery? So then you have to say, so then we have to assess whether she is in immediate risk. So if there's immediate risk, we have to send her to the labor theater and do emergency section. So you have to arrange the ICU facility and these things. But here we excluded that part. We asked for the labor management. Simple. can we allow her to have spontaneous labor or immediate induction of labor? So we haven't asked about anything about whether time of delivery. So here we have asked about the management of labor. It could be expected management. Now she's went to labor, or it could be induced labor. Induced means pre-cervical ripening done. Anyway, now she's in labor. Whether it is maybe augmented labor, or it may be pre-cervical ripening or spontaneous labor. So when do we consider mother for cesarean section in such situation? So if cervix is not favorable, there is no immediate signs of labor, delivery, a mother at risk due to some reason, then so you have to deliver baby immediately. So then you can't wait by giving a vaginal delivery, then immediate section if mother life at risk. There's a bleeding, ongoing sepsis, impending eclampsia, do section and finish it off. What is the place of PGE2 in induction of labor in this situation? So we haven't asked about the how we are going to arrange the delivery in this patient. So if we ask about how we are going to achieve her delivery, so then you have to say vaginal examination, assess the cervix, modified Bischoff-Coe if unfavorable. So put a prostaglandin and induce labor. We haven't asked that part in this question. That is out there. You don't need to mention about the pre-cervical ripening of the cervix because we asked about the labor management. So death in utero in breech presentation, is there any place of external cephalic version? Of course, the breech presentation in death in utero, there is no contraindication, but it is a relative thing. That is individual situation. There is no contraindication. You can attend if a woman is happy, especially if they want to have vaginal delivery. So you can attend. Can we have PDF format of updated unit guidelines? Of course, I will try to get it PDF format and to distribute among you. That is why every time when you are coming to the department, that's been the professional appointment, my advice is to you to go through the guidelines first 1 week thoroughly and understand what is our recommended management in different obstetric issues. So it is a compulsory thing. So everybody should have a copy of PDF format or hard copy and study it before coming to the professorial or first week of professional appointment in our unit. Okay, right. So I have discussed 2 questions in 1 hour. So I think 1 hour has gone already. So I think rather than discussing all 5 questions in hurry, so if you get understanding how to answer and how to get the idea to answer in a correct way, get the maximum marks. So then it is the important message I want to give you. So rather than discussing all 5 questions in a rapid way and then you don't get anything out of the discussion. But if you understand that how to write the general question, how to write the structured essay question, so that is more than enough. And so you will have more understanding in that way. So next time I will discuss the rest of 3 questions. So I will notify you in the LMS. So when I am going to discuss the next past paper questions, the rest of 3. So I try to until you start your clinical appointment. I think up today. So the UGC, they are having a discussion when to start when to open the medical faculty for the students. So probably so there will be a decision today. So then the dean will notify so when to start this thing after the discussion. But until that time, so I'm hoping to discuss with you the 2 past papers question and the past papers question next week. So I will notify that in the LMS. Then so we'll join and discuss next time, right? So there are a few other. Yeah, so again, question asked to is there a discussion date for the restart in the clinicals? That's what the things at the moment ongoing discussion today, the UGC. So you will get the details later on. Yeah, so then question, this another question, 2.2, is there any place for anticardiolipine antibody and lupus anticoagulant? No, at that point, it has to be in 6 weeks time. Yeah, so people have thanks doing this kind of session, but I think, so I personally, I think it is very important. You may know a lot of theory knowledge, you may have a lot of theory knowledge, but even though you have a lot of theory knowledge, and when you are coming to the exam, it's so totally disoriented and very difficult to write the answer if you don't discuss these things beforehand and if you don't practice it. So I believe, so I practice this thing in my career, so I have more and enough the outcomes by doing this way and writing the answers before at least 5 past paper question before going to the exam. That is my practice. So I think it is very important. So I will do this way until your clinical is started, and thereafter also in your lectures. So we'll finish the session now, and thank you very much for joining. And my last message, so you have to fill the, I am sending you the link, so it is in the LMS in my course material. There's a link there. So you go to that link and then there's a feedback form. Please, it is a compulsory quality assurance this thing to fill this the feedback form sent to me through that link. Please tell others also to fill that one, send within 48 hours to same link the feedback form. It is in my course material. Please fill it and send to me. So then we can assess and we can send to the quality assurance cell with following each online lecture. Please fill it and send me within 48 hours. Thank you very much.
Thank you. Thank you, sir.
Thank you, sir.
Thank you, sir.